work. And fortunately, we know what those things are because it is being done in, over 1,000 schools today. So I think what I hope we will all ask ourselves, how can we put those things to work for us across the state so that parents have options to have on-site instruction or remote instruction so that all corners can be happy about the instruction of their children. If we do that, I'm convinced really good things are going to happen in the state of Washington. Thanks, Madam Mayor and Senator. Now I'm going to turn to some discussion of our vaccine program. Really good news in this regard. The pace of our vaccination program and availability are both on an upswing. We are averaging over a 7-day average now 43,764 doses every day. More than 1.7 million doses have been administered in the state of Washington. And we've had 2 days during the last week where we actually exceeded 60,000 doses a day. To put that in context, when we started this, we were doing about 13,000 doses a day. So this has been a remarkable acceleration of our vaccination program and availability are both on an upswing. I had a really joyous morning this morning. We're averaging over a 7-day average now. We're at a max vaccination doses every day. Due to the extreme innovation of people, 1.7 million doses have been administered in the state of Washington. They're now doing over 2,500 last week where we actually exceeded 60,000. Importantly, they've told me today they have the capacity to quite easily go up another 1,000 in a similar type of site. I met some amazing people out there, nurses, assistants, volunteers, physicians. I met a woman named Sherry Bevington, and she had a story. It was pretty inspiring. She fell ill, I believe it was in April of COVID. She was very seriously ill. She was in the hospital for 11 days, but she pulled back. And now she is essentially coordinating the volunteer program for this and other vaccination opportunities, which to me is pretty inspiring because I saw literally hundreds of volunteers doing the traffic control, registration process, helping people. And that volunteer effort is really heartening to me because I know it speaks to the dedication of Washingtonians to help their communities. So I got to make her Washingtonian of the Day because of her inspiration. And I know that her work is going to leverage lots of volunteer hours in the months to come as we continue to expand these vaccination efforts. I feel incredibly touched by this miracle myself. Trudy and I have been vaccinated, and we're so happy that people are now making available 3 different vaccines, all of which are hugely effective preventing hospitalizations and death. And the thought that we will continue saving lives as we have, probably 11,000 lives we've saved because we've been effective and science-based, and we continually to save lives. So I'm very excited about this. So today, because of these efforts and because the supply is increasing, we got some really good news about vaccine eligibility. On our current trajectory, we expect that on March 22nd, a little less than 3 weeks from today, we will enter our second tier of Phase 1B. We are also expanding who will be eligible in this next round. That will include critical workers who work in certain congregate settings will be eligible come March 22nd if our plans come to pass. This again assumes that supplies will increase on the trajectory that we have plans to accept. So this group of people are folks who work in agriculture, food processing, grocery stores, public transit, firefighters, law enforcement, as well as workers in corrections, prisons, jails, or detention centers. Being available to expand to this next tranche of people is really great news in my view. Now, in that same tier, we will include people over the age of 16 who are pregnant or have a disability that puts them at high risk. And I will remind you, of course, that certain child care workers and K-12 staff will of course, are now eligible today based on the Biden administration's directive a couple days ago. So moving forward, I just want to talk to you about the plans after that. So beginning in mid-April, we expect to make additional individuals eligible for the vaccine. By April 12th, we hope that people who are 50 years and older who have 2 or more comorbidities will be eligible for the vaccine. 2 weeks later, on April 26th, people who are 16 or older and have 1 comorbidity will be eligible. Comorbidities are certain underlying medical conditions like heart disease, cancer, diabetes, which could make someone more vulnerable to complications from COVID-19. You can go to the CDC website to look to the description of those comorbidities and apply it to your individual situation. That same day, April 26th, we hope that people living in congregate settings will also become eligible. This includes people living in correctional facilities, group homes for people with disabilities, people experiencing homelessness, who live in or have access to services in congregate settings. Now again, these dates, of course, have to be tentative, and expanding eligibility will depend on supply and our progress in vaccinating earlier groups. But I have to tell you, I am thrilled at the progress that our federal government is making in combination with these manufacturers to increase supplies. I had a discussion with the CEO of Pfizer day before yesterday, who gave us high confidence that these supplies will continue to increase. So what we've done today, we believe these steps are going to make this vaccine much more available for Washingtonians, and we were thrilled by this information. With that, I'd like to turn this over to Dr. Shaw. At the progress that our federal government is making in combination with these manufacturers.
Thank you, Governor. Thank you for your opening remarks and your continued leadership. I just want to underscore a few points, and I think it's really critical as we continue to move forward with vaccines that we remind everybody of the incredible progress that we have made. I know you have talked about the numbers of vaccines that we're administering on a daily basis, and also reminding everybody on just how we now have 3 fantastic, effective, and safe vaccines with now the addition of the Johnson & Johnson 1-dose vaccine. And so we're very pleased to see that, and that vaccine is now starting to come into the state of Washington. And so now we have 3 vaccines that Washingtonians can avail themselves of. And in early January, we were, our every vaccine numbers that were coming in were not as high as we wanted them to be. And so, January 3rd at 29%, and now we're well close to and many times exceeded that 80% mark of vaccines that are coming into the state that are being administered to Washingtonians. I think it's important for us to remember that I look at this as a 3-legged stool of vaccine supply, vaccine logistics and administration, as well as vaccine demand. And really, there are going to be times where the supply is limited and the demand is high, which is really where we are now. There will be times where the supply increases and the logistics become the challenge. And then later on, there will be times where we see that supply is plentiful, but the demand is not as much. And what we want to do is to even that out as best we can. The only constant is that we will continue to be evolving as the situation within those 3-legged stool, each of those legs evolves, we continue to evolve with it. I want to also underscore, Governor, what you just said, which is partners, our community members on the ground, everybody has been really just fantastic at doing all the work to make sure we get vaccines, not just into the arms of Washingtonians, but to also patiently wait their turns, as we know that it has been a challenge at the beginning of this entire process. We've also heard from our partners that they wanted information about what is the look ahead. When does it appear that we're going to be able to move from 1B1, which is, again, seniors, moving to now the addition of educators, and then moving to 1B2, which are the the groupings that you talked about. And I want to just say that it's absolutely critical that as we continue to move in this direction, that we think about why we're making these decisions. And as you know, that we've been working on these logistics and the feedback with our communities for months and months, and our internal plans at the state level, but also working with our local partners. And one of the biggest concerns that we have, and the reason why we want to continue to vaccinate seniors, is that we know that seniors are at risk if they get infected with COVID-19 for a serious illness and or complication. And we want to make sure we do everything we can to continue to protect them. At the same time, as we move into those working in congregate settings, we really recognize, we absolutely recognize the importance of exposure risk. And our data across the state as well as across the country tells us that these workers, these essential workers, are more likely to be exposed because of their everyday functions about putting, the groceries on the shelves, or driving the bus, or doing all sorts of different activities that they are doing to help all of us be able to do and get our work done. That exposes them and certainly makes them at risk for getting or becoming sick. The other thing that the governor mentioned, and I want to also underscore, is that people who are women who are pregnant or others who have certain disabilities, that's also been a consideration based on increased risk. We know these two groups as well can face severe illness or complications if they're infected with COVID-19. And finally, as the governor mentioned, the CDC has for months had a release of information related to those chronic health conditions, what we call comorbidities, that put somebody at risk, and whether that's cancer or chronic lung disease like COPD, heart conditions, type 2 diabetes, of course, pregnancy. These are a few examples, and I want to make sure that we underscore, again, that we're trying to do everything we can to protect individuals from not just getting infected or exposed, but certainly if certain individuals are exposed or infected, that they are more likely to have an adverse outcome, and that's the reason to go in the order that we're going. I want to make it clear that as we're advancing to this next level in a few weeks, we are not leaving anyone behind. If you're already eligible for vaccine, you remain eligible for vaccine, and that's our health workers, that includes those in long-term care facilities, that includes our seniors above the age of 65, those in multi-generational households above the age of 50, and certainly educators as well. Those individuals remain eligible for vaccines, and today's announcements do not change that. But we do want to continue to ask for patience from our community members, from everyone who's about to go into the next phase of eligibility. While it may be your turn soon, and we're very excited about being able to move from 1B1 to 1B2, you may not be able to get your appointment immediately. So we do want you to exercise some patience as we continue to move forward. And again, as the reminder, as we increase our vaccine supply. I just want to close by saying we will get there, and we're going to get there together. We absolutely recognize the importance of working together, working with our partners on the ground. We want to thank them for the incredible work that they have done. We also want to frankly say that we have heard you and we are supporting you. We're doing everything we can to work with you in preventing illness, hospitalization, and death. And certainly I want to continue to emphasize for our seniors, it is absolutely critical to all of us at Department of Health that our seniors continue to seek vaccine, and they do everything they can to get vaccine, but our providers also continue to make sure that vaccine appointments are available for seniors in our state. And so with that, I just want to say, just a reminder, we have variants in our state. We want to do everything we can with these variants for virus, that we need to continue to wear our mask, and make sure that we wear our mask tightly and appropriately and over the nose and over the mouth. and also that we wash our hands, watch our distance, and certainly stay away from crowds, and do everything we can to help fight this pandemic. And with that, Governor, I just want to thank you again, and I want to say that we are really hopeful that we are going to continue to be able to get that vaccine supply so we can increase the number of Washingtonians we can vaccinate on a daily basis.
Great. Thank you, Doctor. Thanks to your team. I saw Michelle Roberts in action today at the Max Vaccination site. I think it's great that we're working with so many local partners, including those who are working diligently to get this vaccine to hard-to-reach communities, BIPOC communities, those living in poverty. I talked to Dr. Chen today that they've worked with 40 organizations in Pierce County to make sure that we get everyone access to these vaccines. That work is going to continue. With that, happy to stand for questions. Great. Thank you, Doctor. Thanks to your team. I saw Michelle Roberts in action today at the Max
First question for Dr. Shaw. I know you said the state is not leaving anyone behind, but there are stories across the country about the very specific challenges the elderly are facing with access because of lack of internet or transportation or even just with other people. So is there outreach being planned for the seniors as more people become eligible? And then for the governor, back to your comments on the importance of in-person learning, I'm sure you know that the teachers union in Seattle last night voted not to return to the classroom. What's your reaction to that, and what role, if any, should the state play to address teachers' reluctance to go back to in-person learning?
Doctor, you want to go first?
Sure, Governor, thanks. So yeah, you know, I would say there are a few things that we've already been doing and we're continuing to do, and really also leaning on our local partners who are, again, are just really doing just an amazing amount of work on the community level. So the first and foremost thing is the outreach. In fact, this week coming, I'll be doing a town hall with AARP to really continue to underscore the importance of outreach to our seniors. We recognize that, you know, tech savviness, actually, to be honest, even I'm not so tech savvy, and I will tell you, there are times where we know that with online appointments that it is difficult, and so really making sure that we have redundant systems so that it's not just online or electronic, but also telephone. You pick up the phone and you can call, or it's a community member or a community group that's helping seniors navigate the system. We're also doing everything we can to make sure that we continue to emphasize to our partners, as I just did, to make sure that senior outreach as well as having appointments for seniors is also in the mix. And so there are a lot of things that we're doing, there are a lot of things that we have done, and there are a lot of things that we are going to continue to do. The last thing I would say is that in our VAC Center, we actually, some of the public-private partnership is also looking at how we can streamline some of these processes and make it easier for the experience for Washingtonians. And some of that even includes taking a page from those seniors who have actually gotten on Facebook in a number of different ways and places to actually get information to their friends and family members so they can help us also champion the messages. We want to learn from them as well. So that is exactly what this is about, is continuing to stay ahead of this, continuing to evolve, and also recognizing that we're all in this together and make it easier for the experience for Washington.
Rachel, I'll mention several things in answer to your question. There's several things that we really do know. A lot of things that are uncertain in life, but there are some certainties. One of the certainties is that we know that thousands of our children, our most precious assets, are in desperate conditions right now. They are in desperate conditions because they are cut off from the magic of in-person teaching. And some are doing quite well, some are doing okay, but thousands are in very difficult situations because they may not have as good a connection as they'd like. It may be because they have more challenges in the learning environment. They may have language challenges. And all of them face the difficulty that even with the best teacher in the world, there is a magic of in-person learning that can't be replaced. Now, I want to say this. I have seen some of the most brilliant teaching I've ever seen, and I've been an advocate for teachers for a long time, that I've ever seen of teachers doing remote learning. including with 3 of my grandchildren who have been remote and now are back on site, and they say it's awesome to be back on site. But what I've seen is educators who have been so innovative, so dynamic, they have torn their hair out trying to keep the attention of these 8 and 9-year-olds to keep them focused on their learning. And I've seen that firsthand, and I deeply appreciate the courage and hard work of these teachers and what they've been doing. But there is a certainty, which is that our children are having learning loss because of the difficulties of remote learning. We also know that thousands of parents desperately want their children back into on-site learning. This is a certainty. Not all parents. Many parents prefer remote learning at this moment. And so we have a certainty that thousands of children are suffering. Thousands of parents want their children back in school. Many parents would like their children to remain in remote. And all of those things can and should be accomplished together. That's the first certainty. The second certainty we have is that this can be done safely for teachers. And I want to take just a moment to talk about this because this is central to this situation. It is entirely understandable that educators, bus drivers, cooks, nurses, counselors have legitimate concerns about this disease. It is a potentially fatal disease. That's really understandable. And when we made decisions early to close our schools and go remote, we were operating in a very much a vacuum of information. I believe we now need to make decisions based on what we know now, not what we know then. And what we know now is that we are fully capable of doing this in a safe basis. And the reason is because we have over 1,400 schools doing that today with minimal, very minimal in-school transmission. In fact, to my knowledge, we luckily have not had an educator be hospitalized as a result of the disease that we are aware of. And the reason we've been successful is because we have found a way, because of the talents of educators, to have children wear masks. And when I've gone around, the compliance with masking has been super impressive on children and educators. Having space, having reasonable things in ventilation, and teachers and school custodians have found a way to deal with ventilation in old schools and new schools to make these safe. Now, if I can just share a little personal perspective on how I look at this. I'm from a family of teachers. My father was a very beloved teacher, coach, and counselor at Garfield and South High School. My brother is a retired art teacher in the Bellingham area. My brother and sister-in-law are retired teachers in East Wenatchee, in the Wenatchee area. And I can tell you, I would never send a teacher into an unsafe working condition. I would never do that. I would never do that for anyone, but particularly when thinking of my brother or my father or my brother and sister-in-law. And that's how I think of this issue. I would have no hesitation on this green earth to ask my brother to go to work today in a school building that had these protocols of the nature that the schools have been using to date. And that's how I look at this issue. Now, we do have to follow these protocols. We do have to have a way to do contact tracing in school, a way to ensure we have good rules of compliance with masks. And these 1,400 schools have figured out a way to do that. So my role in this, since I don't control these school districts, these are local decision making by and large, is to share information with the larger community. And the information I'm sharing with you, I hope, will provide over time additional confidence on how we can get this job done. Fundamentally, this is a challenge between fear that is very human, and we all understand that, and confidence, which also is very important in our community. I think there's a reason that the information I'm sharing will hopefully give people more confidence. And certainly now that teachers have access to the vaccine, which they clearly have asked for repeatedly, I would hope would give them an added measure of confidence as well. But as the CDC has shown, and the evidence has shown, and our own experience has shown, we have a way to do this safely already. So I'm hopeful that people will continue to work together, be mindful of the challenges we have, listen to their critiques that each side will make at the bargaining table. Let's find a way to get these kids have another option. I would have no hesitation to ask for the screener, to ask my brother to go to
the timeline that you put out today, you said it's assuming trajectories for vaccine doses hold. Is that based off of vaccine doses that you've already been promised by the federal government, or is this just your estimate of what you hope will arrive in the coming week?
Well, it's based on the estimates of what the federal government believes they will be able to deliver. And it's a combination of what the manufacturers have told us and the White House team and our own estimates of our own experience throughout this pandemic. A combination of those things. I feel pretty confident that the supply chain will remain as we have estimated. The Biden administration has been very transparent with us. They have come through, and I very much appreciate that. There's no reason they've given us to doubt this particular supply chain. So I feel pretty good about these dates, and I'm really happy to be able to share them with people. Certainly now that commentary has access to the vaccine.
Governor, previous governors have stepped in to help districts such as Seattle to personally go there and get both sides back to the table. Why aren't you stepping in some fashion and trying to get Seattle and other districts that aren't back to the school?
Well, I have had conversations with both sides of the bargaining table, and if I felt that that would be helpful, I would do so. To date, that is not indicated by the parties. And you can be assured that I've been having conversations with both sides of those parties in the hopes that the confidence that I believe we should have can come to pass. As recently as yesterday or the day before, I've been involved in conversation with educators and their representatives. I'm in communication with the superintendents and principals and otherwise, and I'm traveling around the state. So if that becomes something that I believe would be helpful, I could do that. At the moment, if the parties don't think it would be helpful, we want to do things that actually will be helpful. But look, generally what we think is helpful is helping people build confidence. That's what's really helpful. In order to go back to the classroom, both parents, educators, staff need to have confidence. I believe there's every reason to have that, as we have estimated. The Biden administration has been very transparent with us. They have come through, and I very much appreciate that. There's no reason they've given us to doubt this particular supply